Hey, listen carefully. Before you think your blood pressure is just a number you need to manage. If you are over 60, what I'm about to explain could change how you understand what is happening inside your body right now. Because high blood pressure often does not start in the heart the way most people believe. It often begins somewhere else, quietly, without pain. And if you miss that hidden cause, your numbers may keep rising no matter what you do. So let me ask you something. Have you ever taken your medication, seen your numbers improve, felt relieved, and then a few months later your doctor increased your dose again? Because that pattern is more common than you think. And it happens when we control the symptom, but never address what is driving it underneath. Now here is the part most seniors are never told. Your brain depends on a constant, smooth flow of oxygen through blood vessels that pass through your neck. And when that flow is even slightly restricted, your brain reacts instantly. It sends a signal to your heart to increase pressure, not because your heart is weak, but because your body is trying to push more blood through a narrowed pathway. And this compensatory response is well understood in cardiovascular physiology and discussed in research supported by the National Institutes of Health. And over time, that signal can keep your blood pressure elevated without you realizing why. And here is what surprises most people. In many cases, that restriction is not caused by a disease. It is caused by tension, posture, and daily habits that slowly compress those pathways over the years. Now think about your routine. How often are you sitting, looking down, holding tension in your neck without even noticing it? Because that small habit, repeated for years, can quietly affect circulation. And one day, your blood pressure becomes the warning sign. But here is the good news. Before we continue, I want to ask you something. If this information has been valuable to you, please take a moment to hit that subscribe button. Now, let's continue. Once you understand this mechanism, you can begin to support your body naturally. And it starts with something simple but powerful. Hydration. Because when your body is dehydrated, your blood becomes thicker, harder to move, and your heart must generate more pressure to push it through any narrowed space. So starting your day with water helps support circulation. And recommendations around hydration and cardiovascular health are also emphasized by the Centers for Disease Control and Prevention. And over time, this can reduce unnecessary strain on your heart. Now let me show you something most people never connect to blood pressure. The muscles along the sides of your neck, especially the ones running from behind your ear down to your collarbone. These muscles can become tight from stress, posture, and years of unnoticed tension. And when they tighten, they can gently compress the vessels supplying your brain. Not enough to block flow, but enough to reduce efficiency. And your brain responds by increasing pressure. So releasing that tension through slow, controlled movements can help restore balance. And this is not about aggressive stretching. It is about gentle, consistent release that allows your body to adapt. Now here is where it becomes even more important. Deeper muscles in your neck also play a role, especially those connected to your breathing and your nervous system. When these muscles remain tight, they can activate your stress response, keeping your body in a constant state of alert. And when your body is in that state, your blood vessels remain slightly constricted, which raises your baseline blood pressure even when you are resting. So learning to relax these deeper structures is essential. And that brings us to another powerful step, controlled breathing. Because your breathing is directly connected to your nervous system. Slow and steady breathing signals your body to calm down, lowers your heart rate, and allows your blood vessels to open, creating a natural drop in pressure. And techniques that activate the parasympathetic system are widely supported in heart health guidance from the American Heart Association. And even a few minutes of this each day can shift your system over time. Now let me share something that often surprises people. The front of your neck, an area most people never think about, can also influence circulation. When tension builds there, it can affect how blood drains from your brain, creating subtle pressure that your body compensates for. And gentle movements that open this area can improve flow and reduce that hidden strain. And then there is one final step that brings everything together: consistency. Because this is where most people fail. They try something for a few days, feel a slight improvement, and stop. But the tension and patterns that led to high blood pressure developed over years, sometimes decades, and your body needs time to fully reset. I remember a patient who followed this approach, focusing on hydration, gentle neck release, and breathing. At first, the changes were small, but after a few weeks, his morning readings became more stable, his energy improved, and his doctor adjusted his treatment based on those results, not because he forced it, but because his body responded. And this is the shift we are aiming for. Not quick fixes, but real support for how your body works. So starting today, focus on these steps. Hydrate properly, release tension in your neck, support your breathing, and give your body the consistency it needs to adapt. And as you do, pay attention to how you feel, because your body will tell you when things are improving. And what I want you to understand before you leave this video is simple. High blood pressure does not appear overnight. It builds quietly through small habits repeated every day, and the same way it builds, it can be reduced step by step with the right changes. The problem is not that people do not care. The problem is that they wait. They wait until the numbers get worse, until the medication increases, until the symptoms become impossible to ignore. But you are not at that point right now. You still have control, and that matters more than anything else. Because the difference between someone who struggles later and someone who stays strong often comes down to one decision. The decision to take early signs seriously. So starting today, pay attention to your body, respect the signals it is giving you, and act on them. Not perfectly, just consistently. Because consistency is what changes outcomes. And if you do that, you are not just lowering a number, you are protecting your energy, your independence, and the life you want to keep living in the years ahead.